The Genuine Article. Discussion and commentary based on articles from Jack.
Hello, I'm Tony DeMaria, the editor of Jack with Inside Jack, and this morning I'm talking to Chris Kramer, who I'm sure is well known to all of you out there. And Chris is professor of medicine and radiology and director of the Cardiac Imaging Center at the University of Virginia. And Chris has applied magnetic resonance imaging techniques to a really interesting question as to whether or not statins benefit skeletal muscle calf perfusion and or function in patients with peripheral artery disease. So Chris, could you tell us a little bit about the study and what you found?
Certainly. Thanks for having me, Tony. So we studied 68 patients with mild to moderate peripheral arterial disease with mean ankle-brachial index of 0.69 in a 2-year study of LDL lowering. About half the group were statin naive, and we randomized them to simvastatin or Vytorin, both high dose. The other half were patients who had been on statins for some time, and we put them on open label ezetimibe and followed them serially for 2 years. At baseline 1 year and 2 year, we performed a comprehensive MR study, including assessment of MR skeletal muscle perfusion, as well as spectroscopic measurements of energetics in the calf muscle, MR angiography. They also had ABIs repeated and 6-minute walk and treadmill testing with VO2.
So you had both physiological measurements and functional measurements in these patients. What did you find?
Well, interestingly, although LDL was lowered effectively in all groups, we found no change over time in really any of the parameters. There was some slight increase in rest ABI, but skeletal muscle perfusion, energetics, 6-minute walk time, treadmill time, VO2, none of those parameters changed despite effective LDL lowering over 2 years.
Now, you know, we were kind of surprised when we read your manuscript because it's been shown that statins can have a favorable effect on endothelial dysfunction and facilitate vasodilation. So we kind of anticipated that you would have found a benefit. Why do you think you did not?
Well, one of the issues is that we did not placebo control our patients, and it may be that without LDL lowering, one might have found a decline in function over 2 years because these patients are very ill, and one might expect actually others have shown that there's a decline in many of these parameters over time. So the lack of change may interestingly be a positive finding. But regardless, there were no improvements in any of the functional characteristics in these patients with effective LDL lowering.
Do you think that this was independent of changes, say, in the macrovasculature or the changes that the statins might have had on plaque size of volume?
Yeah, we think so. In another manuscript, we've shown that the statins were associated with plaque regression. And despite macrovascular plaque regression, that's in the superficial femoral artery, we didn't find benefit at the tissue level, which tells us that it may be therapies that affect tissue function and energetics and perfusion that will be important to develop over the next few years in peripheral arterial disease to really help these patients walk better and feel better.
Well, I guess the data certainly will not interfere with the indication to take statins. You would agree with that?
Absolutely. Statins are clearly indicated in patients with PAD for their benefit on carotid and myocardial atherosclerosis and preventing MI and stroke.
Well, very interesting data. A bit disappointing to me. I was thinking that I could go on statins and maybe improve my jogging times, but it doesn't look very hopeful. I'll probably still take statins for their benefit on cardiovascular events. Thanks very much for being with us. For Inside Jack, I'm Tony DeMaria.